Uh, Good afternoon, good morning, wherever you all are today. I'm Dr. Eric Shore, I'm a pulmonologist, and we're going to review how to get the most out of an eConsult with regard to pulmonary consultations. Next slide. So the most important thing regarding a consult, whether it's an eConsult, an in-person consult, a hospital consult, is the formulation of a question. If you don't make a clear question for your consultant, you're not going to maximize the outcome. On the screen here is an example of a PCP's clinical question, and it has a lot of good information. But one of the things I think would be very helpful is to have a standard structure to your question. And if you look at this PCP's question, he gives a fair amount of information with past medical history, and the patient has emphysema and symptoms of cough. PFTs were done. And then at the bottom, you see a question: could results in recent PFTs be due to a combination of CHF, COVID, and COPD? And then another question: does the patient need formal referral for follow-up? Then more statements: the patient's stable and not on any supplemental oxygen and was treated with prednisone. So while this has a good amount of information that we can use as pulmonologists, again, I would suggest that you structure it such that the basic information is on top. And once that background is given, formulate your question or questions. And then as the consultant, I do my best, and we all do our best, to specifically answer those questions, which I did in this particular consult. Next slide. So here's the consult that I did, and in it, I make suggestions at the bottom, and between that and the problem discussion, I answer the questions about, for example, in the problem, overall no need for referral to a pulmonologist at this time. And I don't think CHF is playing a big role. So the more specific the questions and the clearer the questions, that helps direct us to answer your questions. Next slide. Okay, here's another statement for patients with post-COVID related dysfunction or pulmonologist. What are pulmonologists recommending for treatment? So this one opens with a question, and then it says, I'm recommending an increase in treatment with Advair. And then another question, would you add a LAMA if it's not well controlled? And then another question. So this would have been more helpful if basically the question was preceded with a statement, something along the lines of, this is a 45-year-old female who had COVID 6 months ago, was hospitalized or not hospitalized, and is having shortness of breath. The patient's on Advair 250, improving, and I've increased it to 500. And then formulate the questions after that. Next slide. And so once again, I attempted to answer those questions in order or not in order. I will address them in the problem discussion and sometimes in the plans and suggestions. For example, should we do PFTs now? I wrote, no, you can hold PFTs for 6 to 8 weeks. Do they need a CAT scan? No, I wrote, no, you don't need a CAT scan now. And should a LAMA agent be added? And I said, no. So again, the key to these consults is a clear questions preceded preferably by some background. And it doesn't have to be very detailed, but then if they're not detailed, we need to have that information provided in the record. One quick example, I had a recent consultation for a pulmonary embolism. A young woman had a pulmonary embolism and was starting to exercise 1 month after the PE and was having shortness of breath. And the question was, do I need to repeat a CTA? Is this normal for her PE? And they provided me with the actual echo and the actual CT scan, which demonstrated a very submassive quantity of clot, and there was no way this person could be exercising at 1 month, and symptoms will potentially last up to a year. So my suggestion was you need to manage expectations, but they gave me the tools with the detail of the CT and the echo so that I could answer the question effectively. Next slide. To summarize, briefly summarize the case, prior treatments, related imaging, summary of your thoughts, and that can be provided in the record, and state the clinical problem up front, and then make clear the questions that you want answered. And you can certainly ask more than one question. Next slide. Okay. Particularly for those who are in Southern California or various parts of the West, some little bit more local issues that you may be facing. And we're going to hit these three very briefly. So RSV is out there now. It's very common, and it is taking down adults now as well as children. I can only speak to adults. So the kind of questions you'd want to know from the adults are, one, have they been exposed to a young child? Do they work in a school? What symptoms do they have? Do they have any pre-existing lung disease? Have they actually been tested for RSV, which can be done with a nasal swab? And then it's a respiratory virus, and it gives symptoms very similar to the other respiratory virus, whether it's flu, COVID, or adeno. That is shortness of breath, cough, wheezing, fatigue. And all three of these clinical elements listed on this slide are basically treated the same way with supportive therapy. So confirming a diagnosis with a PCR can be done with a nasal swab, and then you're going to be left with symptomatic therapy. In terms of wildfires, now some interesting things here. This is clearly an irritant, and the noxious gases and particulate matter that are spewed aggravate pre-existing conditions. So one of the things that we're finding is that there's a significant increase in COVID prevalence when there's smoke and fire in the region. And so, and there's also a significant increase in COVID mortality. So one of the questions you want to be asking these patients is, are you vaccinated? And are you maximally vaccinated? And are you willing, if you get sick, to take one of the pills? What can I do to mitigate this? Should I be recommending starting an inhaler or using your sick plan that you may have already in place for somebody with COPD or asthma, and say, begin treatment as if you were sick in a preventative way? What are you doing to mitigate the fire? Are you sheltering in place? Do you have an air filter? Now, what can we do if you've been exposed? And what can you expect if you've been exposed in terms of the duration of the symptoms? How long can the effects last once exposed to these noxious chemicals? Do they last for weeks, months? What's the expectation? And again, treating this is, again, symptomatic with bronchodilators, mucolytics, et cetera. COVID-19, the thing to keep in mind here is that you're looking to prevent death, and 85% of the deaths are in people over the age of 65. So, with anybody with COVID in the community, your first line of protection here is get everybody vaccinated and get them boosted. And then have a lower threshold than some people do have for using the Paxlovid and the molnupiravir because they do prevent hospitalization and death, even in mild cases, particularly in the vulnerable population. So you want to ask, have you been vaccinated? Are you sheltering? Are you masking when you go in? What are you doing to help prevent COVID? Are you willing to take, is it safe to use these drugs with all the drug interactions? How do I manage the drug interactions? With long COVID, basically, the most important thing you can do is have patience and validate the patient's symptoms. There is no proven way to diagnose this. There's no blood work, and there's no treatment. So your long COVID questions are going to be questions that we all have. What can I do here? In terms of long COVID pulmonary symptoms, we're talking about shortness of breath, cough, pulmonary fibrosis. One question would be, if you can prove the patient does have pulmonary fibrosis, is there a benefit to using an antifibrotic medication in these patients? Do I need to check them for oxygen desaturation? Might they need oxygen? Do I need to do an echo to make sure there's no cardiac involvement? All of those things could be investigated with long COVID, but patience with the patient and validation to let them know that you care and you're listening. So basically, in summary, for all consultations, eConsults, in-person consults, hospital consults, the most important thing is to formulate clear questions, and we'll do our best to answer them as clearly as we can. Thank you. Any questions?